Hello health defenders, Dr. Borja Bandera here, your Spanish physician and endocrinologist. Today we talk about one of the most disabling symptoms there is, low back pain. When do you have to worry about it? What are its main causes and warning signs? What do I do when my back hurts? What do I have to avoid doing? Today we will mainly talk about low back pain or lumbago. We can divide the causes of low back pain into mainly 5: mechanical, degenerative, inflammatory, oncological, or infectious. Let us understand each one of them. Mechanical origin. This is by far the most frequent cause, accounting for 90% of causes. As its name says, there is a mechanical damage that generates a response in the pain receptors and is interpreted by your brain as low back pain. How common is mechanical low back pain? Well, almost 9 out of 10 adults have low back pain throughout their lives, and up to 23% of the world's population suffers from chronic back pain. That means that practically everyone will have low back pain at some point in their lives. This damage can occur in the muscles of the region, which contract violently and generate a hypertonicity of the paraspinal or quadratus lumborum muscle, that is, the muscle on the sides of the spine, paraspinal, or in the lumbar region, quadratus lumborum, are too tense and generate pain. Why do these muscles become tense and spasmodic? Sometimes it's due to an objective and acute overexertion. For example, a deadlift above my possibilities. Sometimes to a chronic overuse, like bending down and getting up to pick up objects for 8 hours long at work. But especially it's due to a very untrained core musculature, abdominal and lumbar musculature, together with a very weak glutes, because glutes are stabilizing muscles. Therefore, you already know what is the most effective preventive strategy to avoid low back pain: strength training and core training. In fact, by strength training, you are indirectly training the core and helping to prevent future injuries, even if you lift heavy loads frequently. In other cases, what happens is objective damage to the intervertebral discs, which are cartilaginous discs on which the vertebra rests. This can generate what are known as lumbar protrusions or hernias, in which the intervertebral disc impacts a nerve that is exiting the spinal column. The best known example is sciatica or sciatalgia, where a herniated disc protrudes the sciatic nerve, which runs down the back of your leg. It's a very incapacitating pain that runs through the entire buttock, legs, and sometimes reaches the foot. We can also have fractures in the vertebra or a slippage of one vertebra over another, spondylolisthesis. Other times, pain is simply caused by muscular injury in the mentioned muscles, example when doing a very heavy deadlift. And this etiology also includes back pain associated with pregnancy. Degenerative causes. The most frequent degenerative cause by far is osteoarthritis, which can occur in the vertebra of the spine or sacroiliac joint. Osteoarthritis is nothing more than the degeneration of a joint, which gradually loses cartilage and develops bony protrusions that cause mechanical damage. With time and the passing of the years, the intervertebral discs, which are like pillows between vertebrae, become dehydrated, and this generates undue friction between vertebral elements. The fractures of vertebral bodies generate the so-called vertebral wedging or crashing and are also included in these degenerative causes. In the worst cases, vertebral osteoarthritis can generate spinal stenosis or narrowing of the spinal canal, which sometimes presses on the spinal cord and spinal nerves, resulting in symptoms such as paresthesias, cramps, weakness in the lower limbs, and pain. Inflammatory origin. This will include spondyloarthropathies such as ankylosing spondylitis or sacroiliitis. These are problems treated by rheumatologists. They have an autoimmune origin and are due to the fact that the body attacks elements of the joint that become chronically inflamed and generate pain. Their treatment is more specific, as there are biological drugs that can help control the symptoms. Oncological origin, that is cancer. Some causes are lytic lesions in the lumbar spine, often seen in metastasis of some tumors that eat the bone, or in bone tumors, or in compressive phenomena, tumors that compress the bone and nerves and generate pain. Cancer often causes what is known as pathological fracture, which is defined as a fracture that has occurred without previous trauma or after an effort that would not normally cause a fracture, such as getting up from a chair. Fortunately, oncological causes are not the most frequent, although whenever there are warning signs, these types of causes should be further investigated. Infections. Infections will be the last category, but are rare nowadays. Epidural abscesses, soft tissue infections, tuberculosis, and so on. In addition to these main causes, there is also refer pain in the back, which originates in very distant sites. For example, gallbladder colics, pneumonia, or renourethral colic can generate refer pain in the lower back. The correct management of mental health problems such as depression or anxiety is key if we also have chronic low back pain, since both situations worsen each other. The simple fact of resting correctly, sleeping, will make you perceive chronic pain with less intensity. In the same way, it's necessary to prevent and manage obesity, because obesity is related to longer duration of back pain and higher risk of recurrence. Smoking, curiously, is related to a higher incidence of back pain at all ages. Red flags. Red flags are symptoms or signs that, if present, require further examination, often requiring imaging tests. Weakness in the lower limbs, especially if it worsens over time. Loss of sensation in the lower limbs. New-onset urinary or fecal incontinence. Pain that awakens at night or prevents night rest. No improvement after 6 weeks of rest. Most benign causes improve with time and rest. Unintentional weight loss. High fever. Chronic use of corticosteroids. Osteoporosis, recent trauma. Those are the main and more important red flags. If you found this video useful and would like another one where we discuss the different options for first preventing and then treating low back pain, leave it in the comments. See you soon, thank you for watching, stay healthy and strong.